Hello. Welcome to Warriors Talk with author of Take Charge of Cancer, founder of Warriors Talk, where we empower individuals to take action that leads to a healthier lifestyle. This is a special edition of Warriors Talk where we are doing 31 days, 31 facts in recognition of Breast Cancer Awareness Month. And we are on day 8, and our topic for tonight is clinical trials. What's in it for me? Let's go. All right, so we are on day 8. Again, our topic is clinical trials. What's in it for me? So let's just jump right into our topic. I know this is a night where everybody is trying to relax, so I will not be before you long. So what exactly is a clinical trial? When we hear the word clinical, we thinking that, they're about to, pull out the utensils and then somebody is about to get maybe stitches or cut on. So let's just find out exactly what a clinical trial is. So a clinical trial is a research project that looks at how well new treatment or medical procedures work in people or on people. So if you're thinking about doing a clinical trial, you may want to stay tuned because we're going to talk about some of the benefits and some of the risks of clinical trials as well. So why are clinical trials important? Because they tell the researchers, they tell the doctors what do and what does not work so that they know maybe we don't have to focus on this medicine because it's not working for individuals, or maybe it works for a certain class of people. So it tells them what the side effects are, and do the side effects outweigh the benefits. You also need to know that how are these clinical trials conducted? A lot of them are conducted in hospitals, they're conducted in cancer treatment centers or clinics, even universities. It just depends on where you get the information from. And I know like a lot of college students or grad students, a lot of times they do clinical trials as well. So who can participate in clinical trials? Well, unfortunately, everybody cannot participate in clinical trials because the researchers and the doctors are intentional about the results that they want. So they don't want chance results. They want strategic results, and they want to make sure that what they're looking for is going to be produced. So they're going to probably give you a series of questions that you have to answer, and also they're probably going to look at your medical records just to see if you're a good candidate for a clinical trial. So not everybody. So how long does clinical trials last? They normally last years, and they normally do more than one clinical trial. So a clinical trial could last 5 to 7 years. And if they're doing more than one clinical trial on that medicine, because you want to make sure, especially if it's like chemotherapy, you want to make sure that you're following these people like past that 5 years to see, how long they're living, what type of side effects that they have, so that when you report this back to the doctors to use, you want to be able to give them some information that's beneficial to the people that they treat. So it could take years for them to come up with new medicine. And I know with COVID, everybody say they came up with the COVID vaccine so quick. How did they come up with it so quick? But they have been working on the COVID vaccine for a while. So it's not like all of a sudden they came up with it. Like COVID just didn't come around, in 2020. COVID been around for a while. So, it was easy for them to treat because number one, at the time when they was doing the vaccine, it was just that one strain of COVID. I know we have like the Delta virus and some other viruses out there, but at first it was just that one strain. So with cancer, it's like cancer has over 200 and something diseases. So if they're trying to do like a vaccine for cancer or trying to do like a targeted treatment for that would cure that particular cancer, you know, they got 200 cancers. So they would have to really target just that one cancer, like, and knock that one out and then just go down the line with the different ones. And we know that they have a vaccine that, for, I think it's for cervical cancer, the HPV. We know that they have that where you can take that shot and it will greatly reduce your risk of getting cervical cancer. So again, these clinical trials can take years. So who pays for this? Like, is this coming out of your pocket? You know, is it coming out of, you know, your insurance? Well, the government agencies, research agencies normally will pay for these clinical trials, and also the National Cancer Institute pays for it as well. You may come out of your pocket a little bit, but normally they give you incentives to do it. They will give you a gift card so that you can, you know, just to give you, you know, some incentives to say, I want to do it, because sometimes if we don't want to do any clinical trials, especially African Americans, because we feel like we have been guinea pigs with the Tuskegee experiment. So, you know, we are not very trusting of the medical system. So 9 times out of 10, if it's a clinical trial that's going on, African Americans are normally nowhere near it, because we tend not to trust the system, because we feel like that, you know, we've been used, and that's just the truth. It's just the truth. So let's talk about some of the benefits and the risks for participating in clinical trials. And there are some potential benefits to it, and one of them is you have access to treatment that's not even available yet. So new treatment that they have come up with, and just like they did with the COVID-19 vaccine, they had individuals that was in the clinical trial, and the only way that we knew that that vaccine was going to be able to work for us is people had to go before us, and they had to be tested, and they had to follow them and document everything. So if you're going to participate in a clinical trial, then you will have access to new up and coming medicine and treatments that has not even hit the market yet. So another benefit of participating in a clinical trial is that you have regular and careful attention from some good doctors. So normally with these clinical trials, it'd be the best doctors, because they want to be able to come out with some, you know, new medicine or new treatments for their patients. So they're going to monitor you really closely. So you may have more doctor's appointments than normal, because they want to make sure that they're documenting everything as it relates to that particular treatment or medicine, so that they know if they're going to use it or not. So another benefit is the treatment may be free or low cost. Again, they may not charge you for it. It should come through the government agency, and if it comes to your insurance, it will be something that they cover, and it wouldn't come out of your pocket. Another benefit to participating in clinical trials is that you get to contribute to research for future lives. You get to save future lives. So if that clinical trial that you participated in, if that medicine or the treatment hit the market, you know, that means that you have helped to save someone's lives, many people's lives. So think about it like that. Like, somebody had to do it for us to take, if you take the flu vaccine, you know, if you take even the COVID vaccine, if you take chemo, if you did radiation, like, somebody had to do it before us, for them to track the information to know that this is going to work. So, okay, number 5 benefit of participating in a clinical trial is that this is the feeling that you are taking control, that you are making decisions as it relates to your own health care, you know, and the doctor is just not telling you what to do, but you make the decision if you want to participate in a clinical trial, because your doctor's office may not even offer the clinical trial. So you may have to seek it out on your own. So, you know, it's like you're taking charge, and you're like, you know what, I want to do this, not just for me. Yeah, you want to benefit from the medicine, but you want to do it for other individuals that come behind you. So we know with any type of clinical trial, any type of new medicine that's coming up, if they're going to have some type of risk, right? So let's look at some of the potential risks as it relates to clinical trials. So this one is not being able to choose what treatment you get. So when you participate in a clinical trial, they're going to give you the real treatment, and then or you may get what they call a placebo, which is or a sugar pill. So they have, the different groups of people, and some people may get that actual treatment, and some people may get the actual sugar pill or the placebo just to see, how they react. Again, they're documenting all of this. So I know if you're participating in a clinical trial, you like, I think I want to get the actual medicine. I don't want to be putting myself out there not knowing that I'm not getting the actual real deal. But that's one of the risks that you encounter, is that you're not going to know. So another risk for participating in clinical trials is that the new treatment may not even work for you. And this is why I said at the beginning is that the researchers and the doctors are really strategic about who can participate in clinical trials. So they're going to put you through a series of questions and looking at your medical records just to see if you even qualify for it, so that they can get accurate results. So it may not even work for you. They may have to pull you off the clinical trial because of the medicine may not be benefiting you. The third benefit to having a risk when you participate in clinical trials is that you may have more side effects than the treatment that you're using. So if that's the case, you're not going to want to do it. So just make sure that if you do participate in a clinical trial, that you're being honest with any type of side effects that you're having. Again, so that the researchers and the doctors can keep an accurate record of what's happening. So you may not even be able to even get through the clinical trial because those side effects are worse than chemo that you are already using. Another risk is this could be a risk, but also I talked about it as being a benefit, that you're having more testing, you're having more doctors visits, so you're being closely monitored. Some people, they get nervous when they go to the doctor, so they may not want to have all these visits. So, but you will, because of it being a clinical trial, they're going to want to monitor you closely. So now you know the benefits, now you know the risks of the clinical trial, you know what a clinical trial is. I encourage you to look up some information about clinical trial. You can go to clinicaltrial.gov. It has information where you can look for clinical trials, and all clinical trials are not medicine. There are clinical trials where it's just like a survey, where you're taking a survey and they're asking you a series of questions. Some clinical trials may be blood drawn, where they're watching over you maybe for a year or two, like having you come in to draw your blood. Like, everything is not always medicine. And it's not always medicine. So I know we freak out when we hear clinical trial because we think we're about to, they're about to poison us, right? They're about to put some toxins in our bodies. But only 5% of Blacks account for participants in clinical trials. So you have African Americans, you have American Indian, Alaskan Indian, Hispanics. They are underrepresented, which indicates that there's a lack of diversity when it comes to clinical trials. So I encourage you, if you belong to any of those groups, that if you want us to be represented when it comes to them creating medicine and treatments that will suit our genetic makeup, that we have to participate in clinical trials. We have to be present. We have to be represented, so that this medicine can work for us. And we wonder why African American women, when it comes to breast cancer, white women are diagnosed more. They get diagnosed with cancer more. But when we are diagnosed, normally we're diagnosed in the later stages, and it's more aggressive, and we die more. So our mortality rate is much higher than that of a Caucasian, which should not be, right? It shouldn't be. But, when you think about it, when you think about our environment, and you think about, how we eat, the lack of movement, all of that does play a role in increasing our risk of getting breast cancer or any kind of cancer. So this was day 8 of clinical trials, you guys. What's in it for me? So I hope that you were able to take away something from the clinical trials today. Tomorrow is day 9. Again, this is a special edition of Warriors Talk where we're giving you 31 facts in 31 days in recognition of Breast Cancer Awareness Month. And this is Lady ReShell, author of Take Charge of Cancer and founder of Warriors Talk, where we are empowering individuals to take action that leads to a healthier lifestyle.